Hello, and welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we will tackle the topic of the day quickly to get you the take-home points that you need. After listening to an episode, you should be educated about the topic and able to fix the issue yourself or well prepared to ask the right questions at your next dermatology appointment. Let's get started. Hello, listeners. Today, I'd like to review how to properly numb for cosmetic procedures in the office. This could be laser hair removal, V-beam, smooth beam, clear and brilliant, or potentially for an injection like Botox or filler. Numbing cream is available over the counter or by prescription. Over the counter, you can find 4% lidocaine in the pharmacy. By prescription, there is 5% lidocaine and also a combo product called Emla, which we tend not to use. We like to stick to plain 4 or 5% lidocaine to minimize allergies. We do sell the 5% lidocaine as a prescription in our office as we are in New Jersey, and we are able to do this, and it's convenience for patients. But once you have your numbing cream, wherever you've gotten it, whether it's prescription in our office, prescription to your pharmacy, or over the counter, the important thing is to apply it 1 hour in advance of the treatment to the affected areas in a thick coat like icing on a cake. I'm going to repeat this. I don't usually do this in podcasts, but I'm going to repeat what I just said again, because this is the part that everybody always forgets. You have your numbing cream. You need to apply it 1 hour in advance of the treatment to the affected areas in a thick coat like icing on a cake. Then I recommend that people bring it with them, because when you get to the office, depending on what type of procedure you're having, we may ask you to take the numbing cream off, which should be in a thick coat. When you arrive in the office, you should be able to see it because it's like icing on a cake sitting on the surface of the skin. And so if we need to take photos, we're going to take that off. Now you might be going back into the room and have to wait another bit of time, so you should have your numbing cream with you to apply another layer, because it works best when it's in a thick coat for at least an hour or longer in advance of the procedure. So many patients either forget numbing cream altogether, or they just apply a tiny little bit, or they don't apply it far enough in advance, and it just doesn't work well if you don't do it properly. The next thing to know about numbing cream is really to understand that it's misnamed. It should not be called numbing cream because it doesn't really make the area numb. It should be called reduction of pain cream because that is what it does. It reduces the discomfort. It takes the edge off of it. It makes whatever the procedure is easier to tolerate. I will say it can make the lips pretty numb because the lip skin is very thin and it can get absorbed better in that area, but generally speaking, it doesn't truly numb things. The numbing cream can be hard to apply to large areas and very messy. I usually recommend to wear old clothing or bring a change of clothes. Some people like to numb and others do not. It really is personal preference. If there is concern about pain and numbing cream works for that particular procedure, I will recommend it to use it in advance as described. An hour in advance, like icing on a cake, bring it with you and reapply. But everybody's pain tolerance is different. We also have a super duper strong numbing cream that we stock in our office for in-office use only. And we apply it for certain things such as Fraxa laser, Elicor, lip injections. It works really well, but it's not available for home use because it is super strong. I'd like to mention the potential problems with numbing cream. Numbing cream is made of lidocaine, among other chemicals, and there are 2 main risks associated with it. One is an allergic reaction because some people can be allergic to the lidocaine topical or some other component of the cream. And lidocaine also can be toxic, and you can get brain symptoms from it and not feel well. And this is why I do not ever recommend using saran wrap on top of the numbing cream. This is advice that is sometimes found online, and people will come in with saran wrap on top of their numbing cream. That is not something that I recommend. I disagree with that recommendation. It increases the penetration, which increases the risks of allergic reaction and, most importantly, lidocaine toxicity, which can be potentially deadly. Never seen that, don't want to, so I do not recommend Saran wrap. If people are very sensitive to different creams and they would like to test it before they use it, I would recommend sort of an open label trial of having the numbing cream and just picking a spot on the forearm and putting it on twice a day, every day for a week or so to see if anything becomes red or irritated. If it does, you potentially could be allergic to that particular cream, and that would be something to talk to me about or your dermatologist. I don't recommend that routinely, but if people are concerned, they certainly can do an open label trial on their arm. We try to remind patients about our numbing protocols in every confirmation email, and we talk about it. People tend not to pay attention or forget, but if you have any questions about numbing protocols in our office, please call us in advance or contact your dermatologist or whoever is performing your procedure. Thanks for listening. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board-certified dermatologist. I hope this episode was informative and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking with you again in the next episode.